Hello, my name is Geoff Hall. I've been asked to speak to you today about the Yorkshire and Humber Cloud and give you the perspective of a user. I'm speaking to you as a medical oncologist from the Leeds Cancer Centre, and I'm also one of the CCIOs for Research and Innovation at Leeds Teaching Hospitals. I'm also an academic at the University of Leeds, and I'm a Professor of Digital Health and Cancer Medicine, and also work with Monica in the YHCR UK Hub for Cancer known as DataCan. The dataset and project I want to talk to you about is a dataset that we created a number of years ago now to support the analysis of longitudinal records in cancer patients. Cancer data nationally has been recorded for many years, but particularly data around the date of diagnosis and what happens to the patient in the first 6 months after treatment. What we have with PPM, an electronic health record system that we use in Leeds Teaching Hospital, is a record that gives us information from just before diagnosis, and then we are able to track the whole of the treatment from diagnosis through each of the recurrences to the moment we discharge the patient to community palliative care. What we were aiming at is a data set that took us from birth to death. And clearly to do that, we needed to link the cancer centre data to data from primary care. The data sets were extracted from Leeds Cancer Centre and from the GP system, System 1, and more specifically, research-specific data sets that are held within both of those organisations. And then following a process of pseudonymisation within each organisation, those data sets were brought together initially at the university, where a second round of pseudonymisation was performed to create a de-identified anonymous data set for the research team to work with. Our original plan had been to use a trusted research environment at the University of Leeds, what was known as the Integrated Research Campus, or the IRC. From the very beginning, we were aware that the IRC had quite limited storage, and in particular for the complexity of analyses that the team were planning, quite limited processing power. We were advised that the IRC had the processing power of a mid-range desktop. There are current plans at the university to move to a new environment based in the Azure cloud, which we hope will be up and operational in January 2021. But currently we have moved this dataset out of the university and we've moved it into the population health system at the Yorkshire and Humber into the Google Cloud. Clearly moving it into the cloud ensures that we have secure cloud hosting and we no longer are under any space constraints. And what has become very clear is we now have unlimited processing power, and the queries that we wish to run will run very significantly faster. Now, at the time, it was not a concern, but of course, we now need to be able to access that data remotely. The University of Leeds is essentially a closed area, and we're unable to access the Leeds Institute of Data Analytics. So the ability to enter our data in the Yorkshire and Humber Cloud has been invaluable. Clearly, to move our data from the university to the Yorkshire and Humber Cloud was not something we could do overnight. We had to ensure that the local and national approvals that we had made to link those two data sets were valid with the move. In particular, we had to submit a modification on our ethics and get national approval to switch the data into the Google Cloud. And we specifically had to seek the approval of the two data owners, i.e. TPP and Leeds Teaching Hospitals. So the university, TPP and Leeds Teaching Hospital all had to approve this move of data. We then did a piece of work with the Yorkshire and Humber team where we defined the data tables that we wanted to upload, and then working with the YHCR team, we were given access to the upload portal, transferred the data. The team very kindly did a quite detailed check to ensure that data process had occurred without problems. We were then given specific user access to allow us to either administrate the database for some users, but also to perform research for others. So once our data sat within the Google Cloud, we of course had access to the full range of capability within that system. And in particular, we had immediate access to the data visualization tools that are in Google Data Studio. And I have to say, I came to that completely new, completely fresh. I had no experience of that before, but within a couple of hours, I was able to generate cross-tabulation of the data. So here are 781,000 records, which can be cross-tabulated in under a second and draw histograms of age distribution, for example. One of the things that I was most encouraged about as somebody who has quite limited SQL skills was that I was able to access the data using Tableau. So Tableau is a data visualization software. It's a license that I have on my own personal desktop within the hospital. And that is the environment within which I analyze most of my data. But what I was able to do was to link Tableau on my desktop to data sitting in with Google BigQuery in the Yorkshire and Humber cloud, and once again produce these visualizations incredibly quickly with drag and drop. And that has really been transformative in the way we've been able to use this data. So what are the benefits and challenges of being one of the first teams to use it? Well, the benefits are really very, very clear. So we have data accessible in the cloud. It's, of course, continued throughout the COVID-19 lockdown and has enabled us to continue to access the data. We have been able to put the security controls of the cloud environment, and we have very tight control of user access rights, roles, and approvals. And with minor modification, we were able to just use our existing governance processes. We were able to use contracts with the staff at the university and also at Leeds Teaching Hospital without the need to generate honorary contracts and a whole load of paperwork. And I guess it's not been tested, but I expect and have no concerns that this is a highly resilient system with full failover and backup. So I feel that the data is incredibly secure. We have been able to work very closely with the Yorkshire and Humber team. They've very kindly uploaded tooling into the system. We've uploaded our studio into that. We've been able to upload specific packages that we want. But I have to say the thing that is most apparent is the power of the system. The speed within which queries can run within the cloud is quite extraordinary. I think it's fair to say it's not without challenges. As with anything, a first user is going to meet challenges that others haven't yet experienced. It took a little while for us to work with the Yorkshire and Humber team to ensure the tables were in the right shape. But we are now in a position where I think we understand the system, we know how to upload our data, and we are now very active and very enthusiastic users of the system. And I'd like to thank everyone involved for the help they've given us achieving that. I'm really sorry I can't be there in person to answer questions, but I'm more than happy if people want to ping me an email to be contacted, and if not through email, then Monica invariably knows where to find me. Many thanks, and I hope you have a great day.